Well, good morning, everyone. Welcome to another live guest interview within Mindful Journey. I'm so excited to bring you our guest today, Dr. Tamara Beckford. Before formally introducing her, as many of you have likely seen her bio in advance, I just want to thank you for being with us as attendees. And if this is your first time joining us, please feel free to put any questions in the chat function. And if you've been with us for a number of these, again, also please feel free to put into the chat function any questions you have. Dr. Beckford is an emergency medicine physician. She is the CEO of You Are Caring Docs and an international speaker. You Are Caring Docs is a business that's ultimately formed to help organizations who may be dealing with employee burnout, something I think we have all either personally experienced or witnessed somebody else close to us experience. She's certainly an incredibly passionate individual. We just recently connected, and I have loved her contagious energy and her smile and vibrancy that she brings. So I'm very much looking forward to the conversation, not just because of her expertise, but because of the characteristics that she brings as a person. So, Dr. Beckford, thank you so much for being here and looking forward to our conversation today.
Thank you so much for having me. And hello to the Mindful Journey team and crew. Hello. I am so honored that you guys have allowed me into this personal space. So thank you.
Of course, it's our pleasure. I'd love to start, Dr. Beckford, and I didn't give too much of your bio away because I want, I'd love to hear directly from you. But could you help us just have a better understanding of what it is that you currently do and
Absolutely.
then what it is that drove you into the medical world?
Okay, so as you mentioned, I am Dr. Tamara Beckford, and I am a board certified emergency medicine physician. I kind of think about it. And day, I help organizations to reduce their stress and burnout through self-care workshops. By night, I work as an ER doc, so I'm a nocturnist. How did I get into medicine? Interestingly, I initially wanted to do pharmacy, but I didn't get exposed to the right mentor at the time. And I was placed in the basement. I was in high school to put things in file charts, some medical record charts in numerical order. And I thought, this doesn't seem right. I don't get to talk to anyone. I don't get to interact. And so I said, I want to do something else. So I applied again, and then I got to shadow a physician. And it was just amazing. The interaction, I just felt like that was my calling. And I was around, like, maybe I was around 15 years old. And from then on, I started working towards, this goal of becoming a physician. And while I was in undergrad, I got exposed to emergency medicine, had no idea that it existed. And
Mhm.
I shadowed someone then. It was an ER doctor. And ironically, she was also a female. And, she was pregnant, she was a female, she was working. She, it was a teaching hospital. So she had residents, she explained things. But most of all, she was just very calm. It was a
Mm,
chaotic world, but she was just calm. And
mm,
I felt such a sense of ease with her. I was one of those people that kind of looked from afar and said, wow,
mhm,
I
mhm.
love the way she handles herself, and she seems to really have a lot of things under control. So I think that this is what I want to do. And the more I got exposed to what emergency medicine does, truly does, the more I fell in love. And
Mm.
that's how I continued onto the path in emergency medicine.
Yeah, I love that. What was it about her calmness that made you feel so at peace, if you will? And what was the maybe what about her calmness made you feel challenged to enter into that space? I love that you brought that up.
Yes, absolutely. So, if for those who have ever been to the emergency room, there's one thing that you'll notice is that it's chaotic, right? So from the outside, it just looks like ants just running around scattered in all different direction. But for those of us who are in there, even though it appears like ants, there's a certain set of order that's going on in our minds.
Mm,
And we have to really channel a lot of energy and be able to direct it appropriately. at certain times. So when I watched her, I recognized that there was a lot of chaos around. And at that point, I was a spectator. And I wondered, like, how is it that she's able to stay calm in the midst of chaos? And I mean, I'll tell you one of the stories that really resonated in me was there was a young lady, and she had this baby. The baby was a beautiful baby, just gorgeous, those engaging eyes, a beautiful smile. I'll say the baby was maybe around like 6 months or so. And the mother, she was just so detached, you know. And when now I realize that their mom had postpartum depression, and it was just the way that this attendant, how she interacted with the mother. She provided, got the services, all the nurses. The baby was so cute. So they held the baby for the mom, because the mom just had, you can just see she was just completely detached from it. So some of this could have been stress, fatigue, but now, as I said, I recognize it as that was postpartum depression. Now, this attending, the way she interacted and provided the services, it was just so beautiful, in a state like that. Now, I know most people are looking like you want to hear the trauma stories. Yes, they existed, but that was such a beautiful and touching moment that now I think that this is what 25 years later, I still remember. Right?
Wow.
That's the power.
That's how impactful it was for you. That's
Absolutely.
that's amazing. Yeah, it's interesting that you said about how it's like to the spectator, it's like ants maybe moving through disorderly, but really to you all, you have it's like organized chaos. You
That's
know
exactly what it is.
exactly where you're going.
That is
Interesting.
exactly what it is. It's organized chaos.
Yeah. Wow. Well, before we get in, because I'd intended later in our conversation to dive into some of the more granular things about medicine, if you will, but I do want to learn just a little bit more about you so we don't get lost in some of that, because I'm very intrigued with You Are Caring Docs, and I have a deep admiration for you forming that. As I mentioned to you on the front end, that's of course how I found you, through your Dr. Tamara Beckford show where you interview physicians. So help us understand what specifically drove you. So we now know what got you into medicine, that there was when you were 15, you had an experience, and then there was something pulling you. But what, after you got into medicine, drove you to create a separate company to help employee burnout?
So that was driven by the pandemic. And prior to the pandemic, I felt a void within my life, believe it or not. I know most people would think, well, you're a doctor, so you've done it. That was your goal. You achieved it. And yes, I did achieve it, and I was very happy, but there was still a void. And then the pandemic hit, and I actually began to thrive during the pandemic, contrary to a lot of my colleagues. And as I looked around, I sit and wondered, like, what shift did I make in my life that made me thrive? And what I recognized was my self-care. Now, prior to that, I really wasn't intentionally pouring into myself. I was just going about life and just doing day-to-day activities. I had way more time then than I do now, but I was way less satisfied with the way my life was going than it is now. Yeah. So that void was there. I looked around and I started to just invest in myself, first really with my mind, and then I invested with a lot of self-development, started reading, additional books. Now my books weren't only medical journals, and it's really brought me back to the way I was like a long time ago before I began the journey to going into medicine. And but when I looked at my colleagues, I saw the opposites. I saw increased anxiety, increased fear. Rest assured, of course, it's warranted, right? We're in the pandemic. And my colleagues, the immediate colleagues, are ER doctors. Now, if everyone who've been in or know of our specialty is around maybe 40 or 50 years old. And no one is alive now who has been alive during the last pandemic. So there might be protocols for other specialties and saying like, okay, if this is how you deliver the baby, this is how you'll deal with this broken ankle or femur or leg or so. This is how you take out the appendix. There's no protocol there in saying this is how you handle a pandemic as an emergency physician. So everything is new, right? So the anxiety level is high. Plus, when we really look at from the safety standpoint, we're physicians, so we're used to going out, especially as ER doctors, and taking care of others. But we're also used to certain equipment, and we're used to being able to use these equipment once. So, and the training that we had was, yes, you use that N95 mask, but you only use it once, and would use it for more like tuberculosis. That was the most common cases that we'd go in the room, we'll place it on, we come out the room, and we'll toss it. If we have to go into the room again, we'll put on a new one. And then when we came out the room, we tossed it. So each time we went in, we placed on a new one, right? So now you can imagine going from that to this disease that's out there, that's really riddled with breathing issues, and people are dying from it. And then we're told that same mask that you used to toss, we're going to need you to wear it for at least 8 to 12 hours. Wow. Imagine the fear. Because although some of, the others see us like, oh yeah, you're doctors, but we're also humans, right? I'm a mother, I'm a wife, I'm a daughter, in addition to all the additional titles. So that fear really ramped up in a lot of my colleagues. For me, I began to expose myself to other colleagues who were on the calmer side and started to look at life in a different perspective. And I just remained calm. We looked and said, well, what are some of the things that are within our control? And then we started to work on that, right?
Yes, love that. Love that. Yes.
Absolutely. And then once we figured out what, can help and what brought me peace and calmness, I said, well, it'll really be selfish for me to just hold on to this, because this scenario, although I took it from the pandemic, there are a lot of people in different industries who are under high stress environments, and I can show them what I did in order to remain calm, to remain level-headed, and to get through. So let me do that. And that's how this was born.
Wow. That is some deep introspection you did, of course, not only to take care of self in those moments. And I commend you for working up the courage to look at the things that are in your control, because we as humans naturally look at all the things that are outside of our control. We dwell in those things and perpetuate more pain in our lives. So I am super impressed that not only did you find a place of calm, but you used an inherent pain that you were experiencing, or maybe your colleagues were more so experiencing, and said, how can I help serve for the greater good? And that's where You Are Caring Docs arose from. Wow. Amazing. Amazing. So I want to, there's so many things I want to ask you, because I'm so intrigued.
That's fine. I'm here.
Yes, yes. Well, let me just start with the burnout thing, because you've been positioned as an expert in that world and serving in medicine. I think that when our society thinks about burnout now, that's the one profession that often is risen to the forefront. So what do you think, Dr. Beckford, contributed beyond the pandemic, maybe even before the pandemic? What contributed to burnout in medicine? And then is it the same in other industries, or is it different?
Great question. Great question. So within medicine, I think, as with all industries, we'll say this is a multifactorial contribution to burnout. Within medicine, there are a couple things that one can highlight. Medicine has there's a hierarchy system, as with most fields. And the training of the, what we'll say like yesteryear is a little bit different than the training now, right? Before there was a set of authoritative type of training. Whatever I say, go, do what I say to do not question me. And so what anyone who's in a position where there's a lack of control, or you feel there's a lack of control, you're going to be at high risk for burnout, right? You have no control within yourself and within the environment. So that's a contributor in some parts. Now, that's something that they're working on a lot, in that it's a more communicative portion versus authoritative. Just do what I say. Another thing is workload. So that's a known factor for a contribution to burnout. Now, the workload in the training process of medicine, I know that they've worked on that and they've changed it. The workload and the hours were very long. I'd say that I think we were even looking at the time when I did training. That's when they just really started to try to enforce the 80-hour work week. And even with that, there were still ways to get around it, right? Certain specialties during the training, it was just like, well, how do I just let my residents just leave, and there's so many patients to be taken care of, like what are we to do next? So there's so many changes that need to occur in order to adjust for this change in the system of the training of medicine. Additional things are financial stresses, right? So those who enter into medicine, a lot of times when you graduate, you're graduating with over 6 figures in debt. So when you enter into the work field, you're already there behind your colleagues, because your colleagues have been working for maybe those 10 to 15 years in the system, and where they're able to donate to their retirement and so on. You're not starting your work life and true work journey until your 30s. And you're starting it with a 6-figure debt. And some people, by the time they get that far, they've lost their drive and their motivation for medicine. So you see, because of the journey along, it took such a long time. Their passion, they've lost the passion because of the arduous task, because of the administrative adjustment, consistent changes, because of I need you to check these boxes. I need you to not do it this way, do it that way. The loss of autonomy in taking care of your patients. You went in there gung-ho, yes, I'm going to be a great doctor. And, you have the mindset of that, maybe that family doctor that you see on TV that gets to sit down with their patients and really discuss, and everything about the patient and their family. And then when you get into real life, you have 15 minutes or less to talk about everything that's going on with the patient, to come up with a plan, and then to put together their prescription and send them out. And then the next patient comes in, and then the next. So you don't get that connection, which is what drove you to medicine in the first place. It's not there. The person just ends up being a diagnosis. Okay, so it's the CHF, or this is the person that had a heart attack. This is the person with the appendicitis. This is it's not saying like, oh, this is Jeffrey, oh, this is Mary, or so all of that contributes to that arduous task. So you can see that how it leads to a mental strain. And it's a conflict of your heart and your mind. So that leads to a lot of burnout. Now, as you mentioned, the second half of that question is like, is this the same with other fields? Now, certain aspects, of course, are similar, right? The high volume workload.
I think everyone can relate to that.
Everyone can relate,
all
absolutely. Within, other industries such as kindergarten teachers or K through 12 teachers, not even just kindergarten, but the education system. They also, 54% of K through 12 teachers are burned out. And when you think about it,
I know that stat. That's high.
it's very high, absolutely. And these are the people who are taking care of your kids, they're providing education, that foundation for life, right? I mean, a lot of people give credit to doctors. I give credit to the teachers that said, I wouldn't be here without the teachers, right?
Wow.
And also those who are in other industries, such as the IT, their stats were up as high as 77%, but I'm pretty sure it's probably even higher now that they're burnt out, the workload. I think about those who were in IT, especially during the pandemic. Can you imagine? Everyone
Sure.
is working from home, so the demand probably rose. So the
Definitely.
workload, and then additional statistics that's out there, or reasons I should say, as to the burnout is change in leadership. And as we talked about, like a lack of autonomy. So, your leadership has changed and you had someone with whom, they gelled with the company and everyone was on the same accord. And then now you have someone else who comes in who just has a completely different leadership style, and the workload is piling, and there are just so many dynamic and shift changes. And of course, that can lead to burnout. So that's, I would say, attributes to the burnout in other industries too.
Those are great insights. And some of those statistics you shared are quite staggering, especially the 54% you mentioned amongst teachers, because, like you said, the teachers are the ones who are training and teaching our future. And if they're burnt out, they're inherently going to be reactive and not caring for our kids, our students, as well as they otherwise could. So thanks for elaborating. I'd love to know, Dr. Beckford, what recommendations you have if there's someone on this call today who feels that they're burnt out, but they're not in a leadership position where they can change their culture. Perhaps they're working for a leader who is authoritarian. What can somebody on this call today do who is feeling like, I'm done, I've had enough, I can't go to work anymore?
The biggest thing that I would say is to recognize that it's okay to take breaks. So I would check within the organization and see what is available for you in order to handle or even start the treatment process of preventing burnout. You're probably very close, or to try to reverse it. There's another statistics out there that says that 96% of companies actually have programs in place to help with mental health and reduce and stress reduction, but only 1 in 6 people are really using those programs. So I would start off by saying, find out if your organization does have a program in store. Do they have workshops? Do they have access through their health plan to employee assistant programs, psychologists, psychiatrists, to help to handle some of this stress? Now, I am saying this for the helping portion. This is not for the part that you said that I'm blaming you because you are the problem. No, we're trying to help us because we're trying to control what we can control, right? And what we can control
Yes.
ourselves and how we respond to the environment. Now, in terms of, you might not be able to kick your boss out, but you can, you can control how you respond to some of the negativity that you're feeling around the office or the environment, and then see if you can have recommendations through these programs to get workshops. So workshops that provide stress reduction, workshops that provide ways for people to recognize the toxicity within organizations so that we can start to address it from that standpoint. So I would recommend that for someone who is currently just in the fire. Find out what your resources are and then start to use them. Now, that might be, say, I'm at this point that I can do that. But say you're just at the point where you can't even get out of bed and you're in front of the building and just in your car crying for 30 minutes before you enter into the building. At that point, if you can take a break, it is recommended that you do take a break. It's important. It's
a great, although it may appear as a simple reminder, it's a great reminder, one that I don't think we can hear often enough, because we so often want to appear superhuman and be strong for others, that it's at our own detriment. So what I'm hearing from you is it's okay to slow down. If you feel yourself burnt out,
Absolutely.
force yourself to take a break and recognize that that break, it does not mean that you're being lazy. It doesn't mean that you're a bad team member, family member. It just means that you need to recalibrate and be here
Mhm.
now. So great feedback. What do you do personally for self-care? What, I'm sure you have a routine or some sort of methodology that you rely on, because to be
Mhm.
honest, somebody from the outside who doesn't know you quite well at this point, I hope we get to know each other much better. Being an emergency medicine
Mhm.
physician, running a business on the side wherein you're helping training, plus you're doing podcasts and interviewing other physicians, and you're a mother, you've got a lot going on.
Absolutely.
So what do you do to care for self?
What I do for Care for Self is what we call a maintenance program, right? So in medicine, we have what's called a bolus and a maintenance. So the bolus is the big, large amount of fluid that we give you, and then the maintenance is that small amount. So that small amount on a consistent basis is what I do, which is I have a routine, a morning routine, and which consists of, so when I first get up, I put my phone way across. So my alarm goes off. I have to get up and literally walk to turn it off.
Love
So in
that.
order to do that, I have reduced the snooze button. So now I'm no longer snoozing because now I've forced myself to get up. And that's a huge improvement. And this is for anyone who's out there that believes I was not born like this. I was a born snooze button person.
Same.
Yes, but I trained myself just a little bit at a time, and I couldn't believe that it actually works. And I've been like this now for maybe over like 3 years of just being able to really get up and just
Hmm.
hit the button and get up and do what it is I have to do. The other thing that I do is that I invest in my mind at the beginning of the day. So that means that I'm not reading emails, I'm not going on social media, I'm not getting any input from the outside world. I am choosing the input that I want. So I do things that's uplifting. For me, it's my spirituality. I listen to uplifting podcasts. I listen to uplifting and motivational messages. And that's part of the way that I start my day.
Hmm.
The next thing that I do, which is very important, but it's challenging for me personally, is movement. So I call it movement and not exercise,
Mm.
because not everyone is going to do a standard exercise. You know, maybe it's dancing, like whatever it is that moves your body. Is it yoga? Is it doing stretches? Is it walking? Or is it standard exercise? So movement is another thing that I do. And those are my morning, or I call that wake up routine, because those routines, sometimes I'm doing it in the middle of the day because I work nights. The next that I do that is a big bonus in maintenance, is something that you're also doing for your team, is that I joined a community of like-minded people. So the community is very important. The
Love
community
that.
will get you
Yes.
through the times where you are feeling stressed, when you do not feel like you can go any further. Most importantly, the community gets you through the times when you feel that you are the only one that's going through these problems.
Mm.
Problems in isolation, right? But the community really allows you to understand, no, no, I've been through this too. And then now what you felt in isolation, you realize that no, this is something that's more common than you think.
Yes. Yes.
And so it normalizes it. And so it helps with the process of going through it. So
Yes.
those are my maintenance. Those are my self-care. I know that people are probably thinking I'd go to the spa and get my nails done. Those are nice for others, but for my self-care, it really is a deeper interpersonal way for me to really tap into my spirit and be the best version of myself on a daily basis. That is a stronger sense of self-care for me.
Yes. Well, thank you. No, I can sense again, the introspection that you've gone through to get to this place. And it didn't happen by accident. It was very intentional. And I love that intentionality, because I think sometimes we just go through the motions and when we aren't aware of how we just, the alarm thing resonates. And you actually got a comment here too from the same guest that looks like one said, and I didn't want to interrupt, but it's life changing to wake up when the alarm rings, which I will agree and attest to, because I've been a snooze button person. In fact, my parents sometimes jump in to listen to these, and if they're on, they're probably laughing right now because when I was a kid, it was the same thing.
Absolutely.
And then the other comment was community is truly healing. Excuse me. And I'd love for you to, if you don't mind, to elaborate a little bit on that because mindful journey, excuse me, sorry,
Mhm.
is a community. That's what we're trying to do, is to
Mhm.
create these conversations where we normalize the difficult topics and the difficult challenges that we inherently all face. So could you maybe just elaborate a little bit on the community piece in terms of how do you find that operating in the community helps you, and what tips do you have for people to be maybe more courageous, to be vulnerable in
Mhm.
that community setting?
Absolutely. So operating in a community has brought me to my highest level of myself. And this is, throughout, I'll say, as we mentioned earlier, when we talked about that void that I felt in my life, yes, you've reached the pinnacle of your career. You've worked so hard and you're here and you've accomplished this. Like, everything should be going well for you. But then there's a void, right? When I found a community of like-minded people, that part of the void started to disappear. And they themselves also had that void, and they thought that they were operating in isolation. So everyone felt that there was something wrong with them. Why is it that I feel like there's a need for me to give more to the world, but I don't really need to give it the way that I'm trained? I have additional skills. I have additional, but how can I bring forth the skill? And then as a community, we're able to pull those skill set out together and support each other during times when you start to doubt yourself. And the
Mm-hmm.
community brought forth that additional strength. I think that I'll likened it to, if we're all standing shoulder to shoulder, and then one person needs to just relax their knee and they won't fall because they have the other holding them up, you know? So that's
Great
the
example.
power of the community. And so everyone there, and I'll tell this to your community too. You'll always have periods of time when you're going to feel weak. And then there are going to be periods of time when you're strong. But the great thing about being in community is that everyone's not going to feel weak at the same time.
Deep. That's deep.
Mhm.
Yes, so true.
So you have someone to pull you up when you're feeling weak. And then when you feel strong, there's someone else who's going to feel weak and you can do the same.
Yes. Why do you think we have such a difficult time, though, when we're in that moment of weakness, asking for help?
Oh,
What
yeah.
is it that causes us to fear vulnerability and
Mhm.
say, hey, I'm not okay? And you probably see it in your world all the time.
Oh, yeah.
Sadly, suicides have risen in medicine, and
Mhm.
that's a prime example of someone being unwilling to
Mhm.
say, I need help. So, what
You
is
know,
it that causes us to not
we
seek
need to
help?
work more on the stigma. And I think our challenge too is, as a society, we laud those who we say have strength. Oh, the fortitude, the strength. This
Mhm.
person, for some of the women, I think it was a couple years ago, one of the head persons in Yahoo, she delivered her baby, and 2 days later, she was on a conference call and taking care of business. And there's a picture of her, and there's this big title out like, oh, yes. And so these are what we put inside This is what we highlight in media. This is what's highlighted there. If someone has a break, oh, they had a mental break, and the tone, oh, it's like,
Yes.
oh, this person took time for themselves, and we're just so happy.
Yes.
So when and the media really has a powerful hold, because that's something that you're seeing on a consistent basis. Now, when we start to change the rhetoric and say, hey, it's important, we're so happy that this person took time off, and they're coming back stronger, and in that time off you can say, like, oh, what is it that you learned, and we're excited to hear about it, and as opposed to, so you couldn't handle the pressure, so you left. That's the way we describe it, right? When someone takes time off, is, oh, they couldn't handle the pressure. How about is, wow, they're really going and recharging, and I can't wait to see what new ideas and how refreshed they are when they come back, so that they can really pour into us. So we have to change the mindset. Once we start to have more of that out there, then the vulnerability will occur. Because even I mean, I'm still here, but I'll still be very guarded at times for certain things that I want people to know, right? Because it's out there. And if when we even talk about the medical field, this is a field where we take care of the most vulnerable people in the population. However, if we need that break because of any mental challenges, it goes on our record. And then when you go up to get your medical, like your licensing or to the board, it's there. I mean, some of the,
Wow.
yeah. So the person who helps others is not able to get help themselves. So that's one of the unfortunate stigma that still occurs, right? So
Yes.
if
Yes.
that stigma is there, then why would someone want to get help? And if the
Wow. I did not
person,
know.
yeah, yeah.
Yeah, I see. My understanding was that in medicine,
Mhm.
that it shifted recently, and of course, you're the expert in it, so I'm only speaking from what I've read elsewhere. I think I mentioned I'd read an article called "Why Happy Doctors Die by Suicide," and it was
Mhm.
all research driven from a woman who had traveled around the world to identify, what contributed to the lack of willingness to seek help. And basically, she narrowed in on kind of what you were saying, that
Yeah.
stigma. But what it appeared is that now medical societies, like within local chapters, if you will, within regions, provide psychiatry and psychologist appointments that are
Mhm.
confidential. Is that in existence? And
Yes.
if I'm a physician and I go to seek a psychiatrist, will that also be on my um, report, or is that?
Well, here there were, so there's some questions that they ask. So all right, there are two forms of this. One is a lot of the physicians, when they try to get help, and some have now changed, but this was the rhetoric for a while. They'd probably do it under a pseudonym. So that it's, yeah.
Wow.
Now people are a little bit more open, but one of the challenge was the question that's asked on your renewal board. Have you or ever taken time off for blank? Why? um, are you, because they're trying to see, are you fit enough?
Right,
So
sure.
so the questions though, um the way that it's worded, and they're working on changing it, but it takes time to change
Thankfully,
something
yes,
that,
thankfully.
but it's like, have you ever been, and then they'll ask these questions, like, been treated for any of these things. And so when you're asked a question like that, or when you look at the board, it might not apply to you now, right? Like, no, this doesn't apply to me because I just graduated, I feel great. But then maybe 5-10 years down, are you going to answer that question? Are you going to go seek help because you're going to have to refill out the recredential paperwork, and they'll consistently ask these questions on it. Now it applies to you,
Mhm,
but
mhm.
I'm not going to seek help because I still want to be able to get credentialed. I still want to be able to be seen. So I'm holding a lot of that in, so that it's not a flag, which is what we unfortunately look at it as. on my
Yes.
record or on my report. Mhm.
Yes, that's quite interesting, and it's good to hear that they're in the works of. I
Mhm.
don't know if this is the American, Medical Association or who
Mhm.
ever ends up being the driver of it, but and this is applicable to all organizations. If I feel that I'm going to be penalized for an admittance of self care, I'm
Yes.
not going to take care of self. So I'm going to now rely on substances and alcohol and other addictions to ultimately have a mechanism to take care. And
Yeah, you're
I,
numb.
yeah, and I, as a patient, fortunately, I've never had anything major wrong in my life.
Mhm.
I'd had digestive things that have sent me in for a CAT scan, et cetera, and it had and a colonoscopy and so forth. But in those moments, I would want my anesthesiologist to be somebody who had taken time off to take care of self, as opposed to somebody who's coming in hungover to take care
Mhm.
of self, because that's
Absolutely.
what I believe probably happens then. And
There are a lot of numbness, and then what you're describing is alternative ways that and people are using to handle the stress and the stressors that's within their lives. And ironically, throughout especially throughout the pandemic, the rise in alcoholism, substance abuse,
mhm,
smoking it's gone up. The usage has
yeah,
risen, and it's throughout all phases, and humans are humans. The way that I look at it, like I am trained as a doctor, but I'm a human. I just have these skill sets. I've done this trainings that have this skill set. And so there are others who it's the same. They have the skill set, they have the training, but they're humans first. So this when you're handling and having to deal with this onset of continuous stress, but the mindset of I cannot stop or seek the help because I'll get penalized or looked upon negatively by the organization for this. I think someone alluded to that also in the chat. Then you're not going to do that. If you're asked, well, why is it that you took the time off? And then especially the next question, explain. And there's this
mm,
empty paragraph. You've seen it. I
yeah,
mean,
yeah,
anyone in the chat has seen it, right? You took time off. Yes. How long? Explain. It's just
yes.
like, okay.
Yeah, yeah, it's a very intrusive question. And in some occurrences, don't get me wrong,
Mhm.
I like I hear what you're saying about they want to make sure you're fit and stable. And again, if I'm a patient, I do want to make sure that my doc
Absolutely.
didn't take 3 years off because they were, drunk and all the time, right? Like, so
Mhm.
I empathize with the explain portion, but if we can soften the
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 rhetoric around
yes.
it.
Yes, yes. Well,
Absolutely.
I love it. I don't want to get too far off because I want to be sensitive to your time. I know that I promised you an hour, so there are a few questions I definitely want to ask that I ask of every guest. But
Mhm.
I'm curious, going back to the medicine before I get into some of the personal things. You've
Mhm.
undoubtedly seen some traumatic events, especially operating in the emergency room.
Mhm.
I of course, I don't expect you to elaborate on anything. Feel free to share any particular stories if you'd like. But how do you, Dr. Beckford, separate who you are from what you do? So when
Mhm.
you go home to your family, you're not bringing home the fact that you just treated a gunshot wound victim who sadly may have passed away to no fault of your own. How do
Mhm.
you separate and detach so that you don't become those tragedies and traumas?
Great question. Prior to entering into medicine, I had a physician who was the father of one of my high school classmates. And I told him, yeah, I want to do medicine. And, initially he says, are you sure? And this is back in the 90s. Medicine has changed a lot. Are you sure this is what you want to do? And then he gave me what I said, yeah, this is what I want to do. He gave me this advice. He said, do not take home the work.
Mm.
Leave the work at work and do not let it enter into your house. And this was in the 90s, the early 90s that he told me that, and I remembered it. And throughout the entire process of my training, I trained with that in mind. Leave work at work and keep home, the way it is. Now, when we're talking about burnout, I recognize that I was close and I was heading into burnout when my work actually started to enter into my house. And this is around 5 or so years after training. And once I recognized that, I changed my environment and I started back over. And then I started to do the same thing again. I keep work at work. And when I come home, my home is my release, it's my sanctuary, it's my place of refuge. So I was able to train with that in mind. And when I'm at work, I give my all to my patients. When I come home, I give my all to my family. Now, of course, it's the times when the shift might occur, right? I might have 60% to give to the family and 40, that's my all that I have left, and vice versa. But whatever is my all, I give it. I also keep in mind when I'm with my patient, I force myself to remember that, during certain times I have to keep stoic and I have to think about what I'm doing in a way that's going to keep me at the sharpest point that I can be as a physician. And then once I finish that, then I bring back the humanness. So what does that mean? I know it might sound like it's it's not a callus. So don't think of it. It's not callus. Alrighty, we're talking about emergent situations. We're talking about situations where time is of essence. And when I say time, I'm talking about seconds, milliseconds, not 30, 40 minutes, seconds or milliseconds. During that time, I have to zone in. So when I'm zoned in, I have to zone in on my task at hand. So I'm not worried about the external factors at that time. I zone in and I stabilize. That's what I've been trained to do.
Wow.
Zone in and stabilize. So once I stabilize, then I can handle and I bring in the additional factors. So then I'll have the family come in, and I'm very known to speak with the family, keep them abreast as to what's going on. But during the time when I need to stabilize, I need to stabilize. Why? Because I need to give your family member the best chance at life, using all the training and the support that I have at that moment. So I do that. Now, I know at times afterwards, we have done debriefing with team debriefs, which is good. That helps to really bring back a sense of what's going on. How does everyone feel? How are you handling the situation? Sometimes it's no matter what you do, it's just going to be hard. It's going to be hard. And it's even more challenging in the emergency room because you have to leave from that situation and then move on to another one. And immediately, because another person is waiting for you. And you never know what you're stepping into right after that situation. So
That I can't, it didn't dawn on me really until now that you just said that, of how not only do you have to detach from a human standpoint when you go home, but from patient to patient.
Oh, yeah.
I mean, if you're with a patient who could, and I'm sure this has happened, this may be a naive question, but have you lost a patient in real time and then had to go treat someone else like minutes later?
Absolutely. And that absolutely it happens. Or even not even losing. One of the losing a patient is very devastating. One of the additional things that's even more devastating is when someone loses their function just like that. When you step back and you think about the person as a whole after you finish that zone in process, you've now stabilized them. And then you look and you said, wow, one bad decision. one bad decision by either that person or by another person has just changed this person's life completely. Those are some of the things that's also you have to, like, you absorb, and then it makes you go home and appreciate what you have at home even more. Appreciate the life, appreciate the love, appreciate the support that you have even more, because you see the extreme at work. And with emergency medicine, it's a little bit biased to the worst case scenarios for the different specialties. So at times, you'll have the person who, let's say, is the oncologist, and that someone has cancer, and the oncologist was able to help them, and yay, we got them through. But when the person is coming to the emergency room, it's because something bad has now occurred.
Yes.
And so, you have to really be able to zone in on that, sit with the person, be there for them when you're the one that's delivering the news that says, yes, I know you've been feeling bad and you've been losing weight, but something bad's going on the inside. Yes, it looks like this is cancer and it has spread. That person's life has changed just like that. They were feeling fine 2 days ago. Yes. And then now I have to go in and tell them that their life has completely changed.
Yes.
It's hard. It's hard.
I can imagine. Well, I'm so grateful for the work that you do, not only as a physician, because from my vantage point, we need more doctors with that type of compassion and empathy and understanding of the human element, because I think that probably only deepens your connectivity and care for the patient. I heard a doctor deliver a presentation a few years back, and he ended his presentation with and this is probably something that circulated in the medical world because it's like from the 1800s, and I think it was a famous photograph. This was before all the technology and gadgets, but basically, I forget who's coined to saying it, but he ended with this phrase very simply. It said, "The best way to care for the patient is to care for the patient." And it hit me, although I'm not in the world of medicine, it brought back to my world of delivering presentations, et cetera, about the best way to care for those you're serving in whatever capacity is to care about the human. So, and I sense that from you. So thanks for what you do and bringing that to light for us here, because I think you've got me thinking right now, Dr. Beckford, just about how fragile life is and how we need to appreciate every moment, because although we're here today, for those listening in who, if they're feeling really good, I don't want this to be a downer conversation, but the reality is that, tomorrow life could look completely different. And you see that daily. So I assume
so, like, as we mentioned, we don't want this to be a downer for those who are listening and for those who are watching. What we really want you to take from this is that spirit of mindfulness, which is why we're enjoying, and that's one of the things that I was able to pull from this whole process, is to really fully enjoy the moments.
Yes.
Right? Enjoy each moment. Enjoy the moment here that we're interacting. And you're probably wondering, I say all these things and I have a smile on my face because I get to enjoy each moment, and I see how powerful each moment is, and I get to pull positive energy from each moment, and that truly is how I get through this whole process. By really enjoying and interacting and taking full advantage of all that I can receive from others in the time that I'm with them.
Beautiful reminder. So well said. Well, I'd like to shift in our time remaining to a little bit about your personal life, to your level of comfort and vulnerability, of course, because I ask every guest, and I think I'd shared this with you on the front end, a series of 3 questions. One, very, very intentionally, to help the listeners recognize that we all face hardship. Because so often in this world today, Dr. Beckford, as I know you probably know, and we may have even talked about, we live in this social media fascinated world where we think what we're experiencing is unique to just us and everyone else has the perfect life. So I'm hoping through this specific question that I want to ask you that we can humanize the conversation in a way so folks listening in are like, oh, Dr. Beckford has challenges too, and she's been able to get through them. So, with that being said, the question for you very simply is, what's the most challenging thing that you've gone through in your life, and what do you recall having done to get through it?
I've thought about this question and in different aspects. At one point, I was going to say, oh, when I didn't get into med school, and it's like, okay, boo hoo hoo. Yeah, that was challenging, but that. And this is when I applied the first time. But then as I'm sitting here thinking, um, you know, I I think one of the most challenging things that I've gone through was actually from 2016. Yeah, in 2016. So during that year is when I had my first child. And my pregnancy, I had to challenge becoming pregnant. And I'm okay with saying this because I think it's important also especially for women out there or for families who are trying to have extend their family or even start a family. It's not very easy. We think it's just like, oh, I want to start a family, and I immediately do it. But I had challenges. And then when I was pregnant at around 24 weeks, I started to have like a preterm labor. So I was placed on bed rest. So by 28 weeks, I was on bed rest and I was in the hospital. And I was in the hospital laying flat on my back for 6 weeks until I was able to deliver. And I still delivered emergently. So when I look back on those 6 weeks, there are a couple of things that, as I think about my reaction to things versus others. So I'm in the hospital room, and actually these walls are the same color as the hospital room walls that we're having this conversation.
Yeah, the
Beige,
irony of it.
yeah, 4 beige walls, and the window. I think initially when they built that part of the hospital, the window led out to a nice view. But as with everything, expansion occurs. So now it's just a parking lot. So a huge high-rise parking lot. So it's just gray concrete out the one window that's in that room. And I laid there, and the nurses each day, they said, don't you want to decorate the room? Don't you want to, put fancy things up? And I said, no, that's okay. And they kept asking, are you sure? How are you feeling? And I said, I'm fine. Are you sure you don't want to do this, do that? And what I realized afterwards is that I didn't want to decorate the room, and I didn't want any fancy or my personal items in the room, because in my mind, this is not where I'm staying. This is just a transition period. So I'm not going to fix my transition period as if it's a permanent place. So that's how I handled that traumatic experience. I ended up and I considered a traumatic experience because, number one, as I'm lying in bed, I am hoping that this baby that I've hoped for so long will make it.
Yes.
And each day I am thinking, okay, they're closer to being viable or being alive if I have to deliver today, because I started at 26 weeks. So at 26 weeks, the chances are still very slim. So each week, I would celebrate internally. Okay, good. The chances are better this week. We're at 28 weeks. Okay, the chances are a little bit better this week. No, I don't want, this is not my permanent place. So I'm not adding any permanency here. I'm just going to focus on what I can control. Okay, the chances are better now. We're at 29 weeks. The chances are better. And it went all the way. I still delivered him very early. And that was also very challenging. He delivered at 33 weeks. And so he had to be in the intensive care unit. That was challenging. And I think one of the most heartbreaking parts was having to leave the hospital. Mind you, I was in this hospital for 6 weeks, but I still had to leave my son in the hospital. And yeah, some of those times were some of the roughest times. But what I did was I worked on building myself up to be the best person I could be physically, because at that point I was very deconditioned. So I couldn't walk. I had to hold on to the walls to walk. So think about like when a kid just learned how to walk, and we call it the cruising phase, when they're cruising and they're holding on. So that's how I was, because I was deconditioned from just laying flat for 6 weeks straight, getting up only to be helped to go to shower and being helped back, and sitting in the shower chair and so on. So what did I do when I came home? There were two thoughts that entered my mind the day that I was brought home from that hospital and I couldn't walk in. One of the thoughts was, I'll probably get a walker or a cane. And the second thought was, hold on to these walls and walk around the house and strengthen those legs. Strengthen yourself. And I decided to not only strengthen my legs, but I signed up for a 5K, maybe 5 or so months. He was born, in the February. My son was born in August. I signed up for a 5K in the February of the next year, because I told myself I'm going to be running a 5K.
That's awesome.
I'm going to learn how to walk again, and then I'm going to run. And I did it. So that's how I moved past that adversity. That's, I had to use a lot of mental fortitude and a lot of projecting positive images of myself in order to get through those tough times.
Yes. So many powerful nuggets in there, Dr. Beckford. And first of all, I'm so glad that your son was born, and he was born healthy, and you made it through those moments, of course. And two things that I want to pull out that I personally subscribe to, and I want to kind of narrow in on and drive home for our listeners with us, because they're so powerful, things that you did in those moments. One is that you gave yourself something to look forward to, which I believe we all need hope. When we're in moments of despair, I think it's important to know that just like our life could potentially change in one moment for the worse, it can also change in one moment for the significantly better. And providing yourself that opportunity to run a 5K, I think, is a beautiful reminder to all of us to challenge ourselves with things that we can look forward to. And then secondarily, I think it's so unique that you said, and I wasn't sure where you were going with it initially, that you were unwilling to decorate your room because it was like, no, this is only temporary, and you were unwilling to put a permanent fix on that. So that's great insights. I'm going to close. If there are any questions, I want to ask you one more before we close, because I know we're just over, but for those with us still, please, any questions you have for Dr. Beckford, if you could put them in the chat function. I think she said she'd be able to answer a few on the back end today. So while I ask this last question, if you want to come up with a question that you have for her, please feel free to put it in the chat function. But Dr. Beckford, my last question for you, and you have been unbelievably amazing today. Your insights shared have been phenomenal. Love your compassionate heart. What is your message to somebody who might be at their wit's end? I'd love to end with some positivity for somebody who's listening in, who's hearing what you're saying, and they're like, yeah, this is great insight, but I still am going through this divorce or this illness and facing a financial difficulty. I just want to throw in the towel. What's your message to that person today to keep going?
I'd say, remember that what you're going through is it's not a unique challenge for the world. It's unique for you. So lean in on the support. There's a support out there for everyone. Lean in, find that support. It's important that when you're going through challenges, you don't do it alone. I know that we are riddled with trying to do things in isolation, and we're very private, but you can join a support system, and it doesn't have to be with anyone who you physically know in your area. Join a support system where you can learn from others. That's the most important aspect within this whole process. Learn from others and learn how others have done it and see how you can incorporate that within your life. So reach out. If there's anything that I can say, reach out. Do not go through it alone. Reach out.
Thank you. Beautiful way to close and a wonderful reminder for us all. I don't see any questions come through. There was one more comment saying, thank you for your time today. I learned a great deal. I echo that. I certainly learned a great deal today as well. You've been phenomenal. Thank you so much. I look forward to staying in touch, and I'll connect with you offline. But thank you, Dr. Beckford. I appreciate your time.
My pleasure. Thank you all for having me.
Of course. Take care.